So I'll teach you the basics, how to write sentences. So I'll teach you the basics. Yes, we can go through this now. So, how we are going to write this particular letter? What is the background of the story? What are the components? And everything we'll discuss. Yes. So take your notebooks, all of you. "76. So here is this first page. So that is the second part of the first page. So to make it a big, I'm trying something so that you can see clearly. Yeah, we can go through this. You can go through this. Anita, Anju, Kamal, Mohammed, Reshma, Simran, and who is this name, please? Write down your name, first name and second name, please, because I cannot call you as the name of a phone. Yes, this is the first slide, the first half of the first page. Yeah. Now, in the first, so you have, what do you have here? Simran Masih. Okay. So you have two different things here. 5 minutes preparation and 40 minutes answering the question. Right. Next, second page. Then third. Then the last. So study this for a second. I'm giving you. Mrs. Annie Ellis, bilateral multiple renal calculi. Yeah. Afterwards, you can take from the here. There you are. Yeah. Now go through this one. Reading time 5 minutes and the writing time 40 minutes. When you are reading, you should not touch your pencil, you should not touch your paper. Just read it. So this is a 76-year-old lady. 76-year-old lady. Yeah. It's the first page. And is a patient in the medical ward of which you are a charge nurse. You are a charge nurse. And this is the address, your address. Your address. So from this, what you can get is your address. Okay. What are the important things you should notice here? Yeah. The most important things in here are, so Mrs. Annie Ellis, okay, is the name of the patient. Mrs. Annie Ellis is the name of the patient. So that is very important. Okay, that is very, very important. And here, she is 76 years old. She is 76 years old. And then this is also important. So these 2 points are very important. And then she is in the medical ward and you are a charge nurse. You are a charge nurse. And the name of your hospital is Berrytown Public Hospital. And the name of the street is 24 Beaches Road. The name of the town is Berrytown. So these are very, very important. And next, another important thing is the discharge date. The discharge date. Think about these 2 things, discharge date and today's date. So the discharge date is very important. So this may be the date on which you are writing this letter. The date on which you are writing the letter. Yes. The date on which you are writing this letter. You have to write the date. And next one, diagnosis. So what is diagnosis? a renal colic. Okay. And when she was admitted, admitted on, discharged on. So all these words will go into the letter. Then, so renal colic, dilation of left collective system, obstructing pelviureteric junction, PUJ, calculus. So this is very important. Okay. Next one. Age is given here. Mrs. Annie Ellis. Here also it is given the name of the patient. And date of birth also is given. Yeah. So these are very, very important. This you have to identify here. What is important information? What should go into the letter? So these points are very, very essential. Others, not important. Yeah. So, who was admitted to the hospital on 12th June 2018, Mrs. Annie Ellis was admitted to the hospital. Okay, like that you can write. And today's date, discharge date. So you write 16th June 2018. These are important things. Okay. So I'm going to post in the Telegram. Yeah. All the important things relevant. So points. How we have taken both the normal letter and the relevant information. Everything is there. Yeah. All the new students and those students are going for the exam. All of you pay attention. And this is the second page. Second page. Okay. Right. Marital status, she is a widow. She is a widow. Yeah. Husband, Fred, December 2015, passed away. Okay. So, residence. Her residence, she stays at Somerset Nursing Home, Garden Street, Berry Town. This is her residence. Right. So, she has daughter Lynn, 42 years, lives abroad. Son Andrew, 45 years, lives locally. So this not that much important now. Social background, retired teacher. She's a retired teacher. You can use this one. She's a widow and she's a retired teacher. And now she is surviving on pension. She is surviving on pension. Okay, hobbies, sport, current affairs, reading, playing poker, amateur tennis player. Until to this is not that important. So forget that. Medical history. Medical history. So August 2005. Now this is June 2018. So cartilage surgery on the left knee. Okay. So no familial disease. Allergic to tramadol. You can see that there. Right. 12th June 2018. This is 2005. This is 2018. Patient admitted with abrupt onset of intense unilateral left loin and groin pain. And this was radiating to the lower back. See this one. 12th June 2018. And the next you can see 16th June 2018. 12th June and 16th June. Okay. So 12th June 2018. Patient admitted recently. Yeah. Upon admission, this was his condition. And vomiting, restlessness, sweating, grimacing with pain. This, you can see that at the time of admission. And urine test was ordered, infection excluded. Okay. Now on admission, the vital parameters were like this. In admission, the vital parameters. You can understand it very clearly here. Okay. Yeah. So this is the second slide. Yeah. So she's a widow and she lives alone. She has two children. Daughter lives abroad, son lives locally. And she's a retired teacher, now pensioner. And hobbies not that much important. And then medical history. August 2005 is a very long time back. So should we consider it or not? The next one, 12th June, recent admission. Patient was admitted with abrupt onset of intense unilateral left loin and groin pain, severity 8/10 intense, radiating to lower back. And the symptoms, so the condition he was experiencing, problems he was experiencing, vomiting, restlessness, sweating, grimacing with pain. And based on this one, his condition, urine test was ordered, hematuria, infection was excluded according to urine test. Then admission timing, the vitals were measured, BP 140/90 mmHg, temperature 36.6, HR 102, heart rate, respiratory rate 21 breaths per minute. So this you can take here. Okay. This is very important. Check it out. Okay. So you should know selective which information I should take, which information I should exclude. So this is called relevant and irrelevant information. Yeah, next, third page. So you can see 12th June medical history on admission and 12th June medications and treatment on the same date after admission. So diagnosis. Diagnosis. Upon admission, what was diagnosed? CT results. So CT scan was ordered and it revealed bilateral multiple renal calculi. So that was confirmed. Based on the CT, bilateral multiple renal calculi was diagnosed, in addition to moderate bilateral hydronephrosis. And dilation of left collecting system and a 4 mm obstructing pelvic junction, PUJ calculus. So this is the diagnosis. Very important. Right, medications and treatment. Medications and treatment. 12 June 2018, patient dehydrated and unable to take oral fluids due to vomiting. What happened in the hospital? Is it important? You have to see. And that depends on to whom you are writing the letter. You are writing to a nursing home. You are writing to a nursing home. Okay. Using the information in the case notes, write a letter to Mr. Paul Ferris, manager of Summerseat Nursing Home. Okay. Garden Street, Berry Town, near his house. Who will be responsible for Mrs. Ellis continuing care at the nursing home? So temporarily she is going there. She'll be taken care of by them. And when she's perfect, then they will be sending them back home. Yeah. Next you see here. Patient dehydrated and unable to take oral fluids due to vomiting. IV, intravenous, diclofenac. Don't write IV, write intravenous. 75 mg repeated after 35 minutes. This all what the treatment you have given, procedure, medication, treatment, everything you have done. Okay. So all these things you need not tell to the care home people. What medications you gave, what treatment you gave, everything is not important. What is important, which is to be continued, those you have to give. Okay. So now the condition is stable. The condition is stable here. And BP here. Right. Now here, this is what you have to discuss. Okay. Medical progress. The step during hospitalization, what happened? You can say during hospitalization. So the vital signs were stable within 36 hours. Okay. The next one, urologist assessment. What did he say? The stone is likely to pass spontaneously within 1 to 2 weeks. That's what he gave his judgment. So this is very important. This is very, very important. Yeah. So that is very, very important. Yeah. So remember that. So now today, patient is fit for discharge with analgesia. So tamsulosin and paracetamol. This is the tamsulosin. Tamsulosin. So from here to here, to continue tamsulosin and paracetamol. Okay. And this tamsulosin was commenced here. So on 13th June 2018. So during hospitalization, this was commenced. And then commenced on paracetamol. So these two were commenced here and they have to be continued. Okay. So during, okay, tamsulosin, 8 mg twice a daily. Okay. Not only tamsulosin, 8 mg twice daily, but also paracetamol 500 milligrams once every 4 to 6 hours have been commenced, which have been commenced to aid spontaneous passage of calculus and for ongoing symptom relief, respectively, comma, have to be continued. So this tamsulosin during hospitalization. So during hospitalization, so what happened? Tamsulosin. Okay. So here, yes. Now tamsulosin, number 1. Okay. And paracetamol, number 2. These two medications have to be continued. Try to understand. So from there to here, these which were commenced during hospitalizations have to be continued. Continuation of tamsulosin and paracetamol, which were commenced during hospitalization. Okay. Okay. Yeah. So you have to relate these two things. It was started during hospitalization but it should not be stopped. It should be continued. It should be continued. That's what it is. Yeah. And analgesia. Patient is fit for discharge with analgesia. Okay. These are discharge medications. Right. Next, in addition to that, a follow-up appointment with the urologist on 20th July has been scheduled. So a follow-up appointment, an appointment for follow-up with the urologist in the outpatient department yeah, on the 20th of July has been scheduled. So you'll write sentences like this. Okay, very important information. Very important information. So no need to write everything. What is important, that only you need to write. So you should know what is important. This is 12th June 2018. Okay, medication and treatment. This is given oral fluids due to wound. So all these things are not that important. Okay. So what is important? You can take that one and you can write whichever you feel this is very important to the nursing. So what will they do with this information in the nursing home? Patient dehydrated, unable to take oral fluids. This is already finished. Now he is stable. So no need of telling all this information. Okay. Right. So collect the information which is very, very useful. So 16th July is today's date. 16th June is today's date. Okay. You can see here. 16th June is today's date. Yes. So how to take the important information? Medical progress is important. Okay. These medications which were given are important. But not everything is new. This is important because it is going to the post-operative stage also. Because he has to continue all these things. Yeah. Is the last one. Discharge plan. This everything is important. All these points are important. No doubt regarding that. This should go into the last paragraph. Discharge plan. This should go into the last paragraph. What they have to do after a discharge. Point number 1. Monitor medications and pain relief. Then increase the fluid intake 2 to 3 liters daily. This is more important. This is one full paragraph. Then monitor urine output. Then use of sieve to check passage of stone and should be sent to lab for analysis. Monitor by dietitian. Okay, these are all dietitians points. Okay, all these are very, very important. This should go into the last paragraph before conclusion. We can say main body paragraph 3. This is very, very special paragraph. You should not miss on this. Okay? You should not miss on this under any circumstances. You see? Right. So next here is the address. To whom you are writing. Using the information in the guest house, write a letter to Mr. Paul Ferris. This is a discharge letter. You can see here, discharge plan. Discharge letter. Yeah. So now here you are writing the letter to whom? Mr. Paul Ferris. And who is Mr. Paul Ferris? Is the manager. Second line. Manager of which nursing home? Somerset Nursing Home. And which place is this? In Garden Street. And which town is it? Berry Town. So this is the address to which they are writing. And then what is the purpose? So who will be responsible? What is the responsibility? What is the purpose? Mrs. Ellis continuing care. Okay, at the nursing home. And appropriate management, monitoring and management. Ongoing care. Monitoring and management. All these things will go there. Yeah. So this is how you are going to write the important. You are going to select the important information. You are going to select the important information. So this is, you will write 3 paragraphs. Upon admission, during hospitalization, and post-discharge. Upon discharge, 3 paragraphs you are writing. Main body paragraph 1, upon admission. Main paragraph 2, during hospitalization. And this one, upon discharge. So this is the way how you are going to organize your letter. Yeah. So you are going to organize the letter. You have to know what is important and what is not important. Because I'm very peaceful now. You see, morning many people will be there, friends will be there, those people will, now everyone will be sleeping, no staff, nobody, no student, nothing. So I can explain you very clearly. Yeah. I can focus more on individual students so that you can understand everything clearly. So there is a Muhammad Majid, one new student. This is for everyone. Many people think that, oh, we know how to write letter. This is not a problem. Okay. But it is a problem. So Muhammad Majid. Now let us see. Rename Muhammad Majid is a new student. He is attending every day night sessions, very regular. Muhammad Majid, can you unmute?
Yes, sir.
Yeah, can you understand the importance of this quality now?
Yes, sir.
So See, for example, if in the daytime we'll hurry up and we cannot focus on many things. We may miss some important points. But now relax, and nobody is there to disturb. You are alone, you can relax and you can study very nicely. Because all the children are sleeping, parents are sleeping, they have finished their duty and everything, they are going to rest now. They are all tired. So nobody will be there to disturb us. So this is the perfect time, right?
Yes, sir.
So do not miss these sessions under any circumstances. I understand you are very obedient. So that's why I gave you admission. You said, I will not work, sir, and I want to dedicate this one. Okay. So very good. Next. Next is Anju Kumari. Hello, Anju Kumari. Anju Kumari. Can you unmute? You can just unmute. Yeah.
Yes, sir.
Yeah. How is the session, Anju Kumari? Is that beneficial? Point to point, am I explaining?
Yes, sir. It is. Yes, sir.
So,
It is.
in the daytime, if we'll take in 15-20 minutes and quick. Now with peacefully we can explain each and everything, right?
Yes, sir.
So the same goes with the doctors and nurses. Anybody, it is the same letter. That is the reason. Now nobody will tell me, come on, I don't have time, finish it fast like that. Who is really, this is my personal session. Nobody is paying for these sessions which I am giving in the evening. They are paying for some lectures, reading and listening, and for some writing corrections and speaking sessions. But this type of sessions, okay, this is my interest to explain everything so that you will perform and get good results. To get A grade, B plus, like that one. So I'm giving you quality sessions. So do not miss these sessions under any circumstances. Okay? Yeah. Next. We have Rajani. Hello, Rajani. Can you unmute, Rajani? Okay. So, right. So, all of you, do not miss these sessions under any circumstances, whatever comes. Now, let us see how we are going to write these points. So, hide floating. Yeah. Now, we are going to take we are going to write a letter. So, what you can do is you can go to the Telegram channel and then you can search here. You can go to the Telegram channel and then you can search there. What you have to search? Just type there single page or quality check answer sheet. So single page is only one page. Quality check writing answer is, this is 4 pages. 1, 2, 3, 4. So this is 4 pages. But what I took is single page. You can take single pages here. This is full sheet. Okay. And this is single page. What you can do is you can download this one. Just download this one. And then we'll write here. In this only you have to write. I will correct. If you write in some other pages or somewhere, I will not correct your paper. I want you to write in this. This is our official paper. Okay, quality check. So learn how to write in the exam. That's what I'm telling you. So now we are going to write in this. What we are going to write here? First, we are going to write the yeah. Leave the first line, this one. Don't write anything in the top line. So you can start from here. You can start from here. Yeah. Now what you are going to write here? So let us see here. Yeah. So it is, the first thing is Mr. Paul Ferris. So we are going to write these things here. This is the address to whom you are writing. So you are writing to Mr. Paul Ferris, Then next one is manager. Next line is summer seat nursing home. Next line is Garden Street. Next line is Berry Town. So these 5 things you are going to write. So how are you going to write here? Yeah, we'll write like this. This is called the address. Number 1, the address. Okay, number 1, address. Have to reduce this. Change this. Okay. No. Okay, leave that one. Okay, Mr. Paul Ferris. So step by step, I'm going to show you here. Mr. M capital letter, Mr. Paul. Ferris. Don't write comma, don't write anything. I'm patiently explaining you about everything. So, Mr. Paul Ferris. Start from this first dot. See from here. The line should be straight. Okay. The line should be, you see how it is. Like this. It should be straight. Should start from here. Like this. From the first dot. You should write from the first dot. Okay. From here. Do not miss that. Next, second one. Manager. Here, second line. Manager. Should also start from this one. Next, third line. Summer seat nursing home. Summer seat is one word. Summer seat nursing home. All the first letter should be in capital letter. SUMMER. Summer. See, summer seat nursing home. Don't worry, I will give you everything. Only you have to be ready for attending whenever I am giving. Next one, summer seat nursing home. Garden Street. Now, Garden Street. GARDEN. Garden Street. So, Garden Street. Garden Street. Yeah. And next, Berry Town. Berry Town. Write that one here. Berry Town. BERRYTOWN. Berry Town. So I hope you understand from where what is coming. So 5 lines. Okay. So we got all the 5 different things here. Okay. Yeah. So you have to write everything in a straight line like this. Straight line. It should be top to bottom in a straight line, starting from. Don't write in this white space and don't write, leave any line like this. Sometimes people will write like this. What is that? New town, like this. No, you are not supposed. See how it is. It's not fair. See here. You're starting like this, but it is going inside like this. This is not nice. There should be in a straight line. There should be in a straight line. Now leave one line here. Leave one line here. Leave one line. So, right, if I don't tell everything also, no problem. Okay. So learn whatever I am teaching, learn that perfectly. Okay, little enough. No need everything and get a headache. Step by step, whatever I am teaching, you learn that perfectly right. Okay, no need 100 things. Few things, but learn them perfectly. Your handwriting should be very neat when you are presenting something. Next one. After this one, you will write the date. So let us see today's date. Today's date is discharge date. Today's date is not given here, any other date. So in the exam, you write the date of the exam only, so no problem. If you are writing on 24th of March, you write 24th March. If you are writing on 9th of 24th February, you'll write 24th February. 9th March, 9th March, you'll write. 23rd March, 23rd March, you'll write. Like that. Date you're going to write. There is no question regarding this. So this is 16th June 2018. We are going to write this one. 16 June 2018. Again, margin should be 8 maintained. 16 June 2018. 16 June 2018. Like that you have to write. Now see, again, you have to write from the beginning. First dot. Right. Now again, you are going to, yeah, leave one line again. Afterwards, leave one line again. And next, what you are supposed to do? So you are writing the salutation. Where is salutation? Salutation you take from here, Mr. Paul Ferris. The same thing you can take here. Dear Mr. Ferris, comma. Yeah, dear Mr. Ferris, comma. Yeah. So write very neatly. Yeah. So Mr. Paul Ferris, manager, Somerset Nursing Home, Garden Street, then Berry Town. So that's done. 16th June 2018. Dear Mr. Ferris, comma. Write second name. Do not write first name. Do not write first name. Write second name. Here full name you have to write in the beginning. But here you should not write. Whenever you write in the first time, for the first time you have to write full name. Then next, second time when you write the second name. If they are below 18 years of age, then you have to write the first name. Then next, again leave one line. So every component is over. Leave one line there. Yeah. So next, yeah. Next one is, you are going to write the subject line now. What is the subject line? Regarding whom is this? Regarding whom? So regarding, what's the name of the patient? So you have to write this one. You have to write this one here. Mrs. Annie Ellis or Mrs. Annie Ellis. There are two places. Here also it is there. There also it is there. And now you have two different things. Date of birth is there. And then age is also there. So now there are two options here. Age or date of birth. If only date of birth is given, write a date of birth. If only age is given, date of birth is not given, then write age. If both age and date of birth are given, then don't write age, write only date of birth. Because date of birth is more important than age. Then when both are given, you can write the date of birth in the subject line and age in the letter. Okay. Mrs. Annie Ellis, comma, date of birth, colon, 6/1/42. 6/1/42. So don't write like this. Whatever is there, don't write like this. You have to write. How are you supposed to write? How are you supposed to write? Date of birth, 6, date, write it like that. And these slashes, full stops, dots, remove, no need anything. This 1 is there. So you can write it as January. Don't write 1. You have to write January. So regarding Mrs. Annie Ellis, date of birth, 6 January 1942. Like this you have to write. For example, alternate method. If date of birth is not given, then how you will write? Okay, how you will write? I'm putting in brackets. Then you will write like this. Regarding Okay, Mrs. Annie Ellis, comma, aged 76. Finished. So this is another option. If age is given, date of birth is not given, then you have to write like this. I have put in the bracket, that's why. Okay, this is alternative method. Yeah, yeah. So this is how you are going to write. I put it in the box because that is secondary. This is more important, either like this or like this. You are supposed to write. Mansi, what is the spelling of right? Write, right. Sir, if we write patient name first, I did not get you. Where you will write patient name first? Dear Mr. Ferry. Okay. Yeah, what is the problem? Patient name first. Sir, if we write a patient name first, that is subject, ne? That is regarding. Yeah, so you can write date of birth in next line. Yeah, you can write. You can write in the next line also. Definitely, no problem. That's not a problem. Okay. So you have another option. What is that option? Yeah, regarding colon Mrs. Annie Ellis. In the next line is date of birth colon 6th January 1942. Yeah, why not? You can also write like this. This is another option. Yeah, this is another style. So that is also right. You can write like this. How to address those below 18 years? Regarding, just write the name, no Mr., no Mrs., nothing. Yeah, but when you are talking, in the regarding line, you write the full name without Mr., Mrs. Okay, just Abraham Lincoln, that's all. But in the letter, when you write the first name, not the second name. Regarding Mr. Abraham, Lincoln is second name. Don't write second name. First name you have to write. If children below 18 years of age, you should write the first name. That means Annie. That's all. Annie, who was diagnosed with. That's it. So far, so good. That is done. Are these starters? We call this as starters. I call. Are these starters clear? Or do you have any doubts? Are these starters clear? Say yes or no. These four things: address, date, salutation, and subject line. Are these four clear or not? These will come in the beginning. These are the four things. These are the four things. So if it is clear, then we can move to the deserts. Deserts, these are the starters. These are the starters before the main body of the letter is there. Okay, we use these things. Okay, these are the starters. The starters before the letter. That is the main course. The starters are four in number. Number one, number one, number one, the address. Number two, the date. Number three, the salutation. Number four, the subject line. So these are the four things which are very, very important. These are called as starters before the letter starts. So you have to conclude with these things, finish these things. Yeah. So you are clear here now. So these are the starters. Four things, one, two, three, four. If that is clear, so shall we move to the deserts? Shall we move to the finishing touches, to the deserts? So if you are clear, then we'll move forward. You can write S, capital S, if you are ready. Yeah. So it's very clear. Whenever you are writing, these are the things that you have to follow. I will not teach everything on one single day. Okay, because you have to focus on those things. The next step, we are going for the deserts. Now, what are these deserts? Yeah. So now second page. Yeah. Okay. Yeah. Now we are going to the deserts. Now what are the deserts? Deserts are the last 2 points. So let us take the deserts. The deserts are number 1. So we can take it as a 1, 2, 3, 4, body 5. So sixth one, the closing remarks. Yours sincerely, yours faithfully, like that we'll write. Na? That is closing remarks. Then next, seventh one, the sender's particulars or address. Okay. So these are the deserts. So those after body you will write. So from here we started. So you'll write the body of the letter here. You'll write the body of the letter here. Then continue till here, body of the letter. Then here somewhere you'll write. Okay. Then here you'll write like this. Maybe let us take 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So here finished. So this body is finished. Now next leave one line and start here. Okay. Yours sincerely. Yours sincerely, comma. Yours sincerely. So here before that you will leave one line. Na? Yeah. Here before, after the body, before starting yours faithfully, you leave one line. Then after yours sincerely or yours faithfully, you leave 2 lines. Then you write the address. Now what is the address here? So you are a charge nurse. Your name is not given. So charge nurse, this one. Charge nurse. So charge nurse. Okay. Charge nurse. The next one, where is charge nurse? In the medical ward. You can see here, medical ward. So you are writing the address now. Medical ward. The next one. Name of the hospital is Berrytown Public Hospital. Berrytown Public Hospital. Yeah. Berrytown Public Hospital. Then next one, 24 Beach Road. 24 Beach Road. 24 Beach Road. Beech. Okay, Beach Road. Berrytown. Next line is Berrytown. Yeah, Berrytown. So I hope you understood what I am telling you very clearly. Anju Kumari, what is given you have to write like that only. You cannot write your own things. Okay. Charge nurse means more than registered nurse. Registered nurse is anybody. Charge nurse means nurse who is in charge, senior, the boss, who has the charge of the entire department there. So these are the deserts. So what is given there? It is given charge nurse. So write charge nurse. That's it. Yeah. Charge nurse, medical ward, Berrytown Public Hospital, B24 Beach Road, Berrytown. Yeah. Yeah. That's done. Yeah. So these are the last two, sixth and seventh. And fifth is the body of the letter. Fifth is the body of the letter. Okay. Now it is 10:52. So if you are comfortable, I'll teach you. There are new students. Anju Kumari. Yeah, Dr. Rani. Okay, I want you to get okay, excellent grades. Yes, those who have listened to me and followed my style, they have got a 300, sorry, 420, 430, 440 also. 460 also people got. You can see our telegram. You will know that. So Muhammad Majid and Akireddy Rajani. So now what I want to ask you is, now I am going to the main subject. That means body of the letter. Are you ready? Can you take it? Or you want another day? I am ready. I am full powerful. I am very full powerful. I told you, no, my power will increase when everyone gets tired. So if you are ready, give a yes, all of you. 1 second, I'll give you a question. Are you ready for a fierce battle Some words, if you don't understand, no problem. Fears means frightening, scary. Now give the answer, yes or no. Now, out of these 11 students, at least 7 students I need after my question. Are you ready for a fierce battle? Rajini, Mansi, Rajeshwari, Anita, Rani, Anju. I need one more. One more. 7, at least 7. Yes, yes. Okay. Majority wins, ne? Rajini, Mansi, Rajeshwari, Anita, Rani, Anju. One more candidate. Yeah. So 6 candidates are there. What about the others? Huh? So others are new students. I think they don't want to respond. Yeah. Okay, fine. All the regular students have given. So I'm going ahead because there are new guests there, so they don't know what to do. So that's fine. And who is this iPhone? iPhone. I cannot call you as iPhone because I don't teach to iPhones. So first and second name. Kamal. Yeah. Kamal did not respond. Kamal, you can say yes. One more. So that we can go into the depth of the subject. Yeah. So we are going to the yeah. In the first page, I have given starters. In the second page, I given desserts. Now I'll give you introduction. So this is starters, this is desserts. Now this is the introduction. Now we'll see about the introduction. Yeah. So in the introduction, so this is the third page. So this is the desserts page. This is the starters page. Now in the middle, between starters and desserts, between the beginning, first you have starters. When you go to a hotel, they'll say what starter you want. After finishing that one, they'll say, now can we serve your main course? Then main course will be served. Then afterwards, do you need any desserts, ma'am? He will ask. Ice cream, salad, fruit juice, like that. Starters means soups, salads, starters, or drinks, lemon juice, or something like that. Those are starters. These are desserts. Now main course. We're going to the main course. Main course. So 5 paragraphs. We'll write in 5 paragraphs. So Dr. Naresh, Dr. Alinda, Dr. Rani, Dr. Swati, Dr. Arshia. All of you have taken the speaking sessions. Very good. Your audios are here. So tomorrow I'll analyze your speaking sessions and I'll take you personal sessions. So is there anybody here? Yeah, Dr. Rani. Then Dr. Arshia messaged me. Yeah, right. So the introduction. The introduction. So first leave some so address and other things. Suppose like that one. After address and other things, Majid has done his speaking session. Very good. Anju, have you done your speaking session today? Anju. Vijay, Asha, Simran, Vinita, Yogendra. Anju, did you do your speaking session today? With whom? Anju, with whom did you do the speaking session? I did, yeah. You have done with Priya. Yeah, I got it. I'm sorry. I missed it. I just from the number three, I jumped to number one. Yeah, I've got it. Sorry for asking because I wanted everyone to do practice sessions. Yeah, then only you can come to me. If you do not practice, no, you cannot come to me. It will be very difficult. Okay, so let us start from here. So these are the starters, suppose. So we are what did I do here? Okay, so later it will come separate. Okay, I'm starting here. What is this? Okay, file save. Yeah, thank you. Yes, so I'm starting from here. Now here, how you are going to write? Take your notebook and make notes accordingly. Otherwise, also no problem because I have recorded it on the YouTube. Afterwards, you can make notes. First, concentrate. No need to write anything. Just focus here. Afterwards, you can take from and make notes. No problem. I know nobody will make afterwards, but just learn fully here. Now, when you're starting the introductions, first start with the name of the patient. So, Mrs. Ellis. So patient, who is the patient? All these points should come here. Patient's name, patient. That is number one. Okay. Number one, point number one. You have to write the name of the patient. Now, who is this patient? Who is this patient? The patient's name is Mrs. Annie Ellis. But you need not write full name. You just write Mrs. Ellis. Second name is enough. Second name is enough. Next, number two. Number two. Yeah. Number two. what is this stage going on? Okay. You can say different stage, diagnosed stage, or there are many different stages. Signs and symptoms stage, diagnosis stage, visiting stage, admitted stage. Okay. Then underwent surgery, recovering stage. Okay. So these are the different stages. First one is visiting stage, signs and symptoms stage, admission, diagnosed stage, admission to the hospital stage, during hospitalization stage, recovery from the problem stage or recuperating stage. So all different stages. Okay, what type of stage is this? This is diagnosed with multiple bilateral multiple renal calculi. Dr. Arshia, yeah. Dr. Arshia has done 4. 16th also. Okay, 16th she has sent. Okay. Yeah. Right. So, diagnosed stage. Then next one. What was diagnosed? Okay. What was diagnosed? That means number 3. The problem. The case we call it. The case. Here it is the stage. Okay. Here it is the stage. Here it is the case. Okay. The case is bilateral multiple renal calculi. Okay. Okay, here. Bilateral multiple renal diagnosis. Bilateral multiple renal calculi. Here it is. First line. Yeah. The case is bilateral multiple renal calculi. Then, number 4. Number 4, those who are sleeping, they will miss all these things. We don't mind. Tomorrow you get up late. Now, what is the problem? We are learning the best things. And everyone is sleeping. We are working hard. What more we need? This is the reason why students come to me. So, I cannot tell this much normally. When I am happy, when I am peaceful, when there is no disturbance, I can give you a lot of information like this. Number 4, the type of letter, the modus operandi. So the mode of the letter or the type of letter. So you can say the letter type. What is the type of letter you are giving? This is a discharge letter. This is a discharge letter. Name of the patient, the stage, the case, the type of the letter. The next one, Number 5. Number 5. What does he require? The purpose. The purpose. The purpose of the letter. What is the purpose of the letter? What is the purpose of the letter? The purpose of the letter is ongoing care and appropriate management. You can see here. You have to write for what? Ongoing care, continuing care, continuing care or ongoing care. So what is it written? Let us take like that only. Continuing care and appropriate management. Management, how? Monitoring, checking, guiding, providing education, telling everything, taking care, okay, dressing changes, all these are management. Continuing care, caring for him. Okay. Then, what is the present situation? Number 6. The um, the scenario. The scenario. What is the scenario? So he is being discharged. Okay. Is being discharged. Okay. Is a discharge letter. So the scenario is being discharged. Next. Number 7. Number 7. The time of the time. Being discharged. Okay. When? The time. When? Today. Is being discharged today. Okay. Now this will take a point number 8. Number 8. Okay. Number 7. The destination. Where is he going? The destination. Where is he going? Okay. There is being discharged to your facility, to your nursing home, to your facility today. I think everything is clear for you now. Everything is clear for you now. Ongoing care is one word. Ongoing is one word, Anju. Ongoing is one word. So, next. So these are the 8 things. If I am writing this letter, how I'll write? So, Miss Ellis, comma, who was diagnosed with Miss Ellis, who was diagnosed with bilateral multiple renal calculi comma, Miss Ellis, who was diagnosed with bilateral multiple renal calculi. See, I made a mistake, unknowingly. I corrected it now. If you check, we can make corrections. Miss Ellis, who was diagnosed with bilateral multiple renal calculi, okay, till there is okay, is, sorry, requires, requires what? Continuity of care or ongoing care. Change the word. Ongoing care, regular monitoring, and appropriate management following the discharge today. So here requires ongoing care, regular monitoring, and appropriate management at your facility. Okay, at your facility following the discharge today. Today we are discharging, we need this. So this is how I write. Suppose example, this is one way of writing. There are many ways of writing. There are many ways of writing. There are many ways of writing. Yes. So there are many ways of writing. What you are supposed to do is you can write your own sentence. You are supposed to write your own sentence. Yeah. Learn to write your own style. There are multiple styles you can write. Okay, this is the way how you can write a solid introduction. Miss Ellis was diagnosed with bilateral multiple renal calculi. Oh, I forgot to order my dinner. Yeah, come on, write down. Oh. All of you mute your audios. Yeah. Yes, write your own sentences, please. You can write in any way you want. Rajeshwari, Anita. Yeah. Now I'll teach you some other sentences. Yeah. Yeah. Now this is introduction. Okay. Now conclusion we can write in the same way. This is the introduction. The introduction. So 5.1. The introduction. So this is how you will write the introduction. And the conclusion also you will write in the same way. Okay. Based on the aforementioned circumstances, comma, okay, right. This is conclusion. In between body line, that is different thing. This is conclusion. So we are writing the conclusion 5.5. This is the conclusion. 5.2, 5.3, 5.4, that we'll see later. The conclusion. Based on the aforementioned circumstances, to write the same thing but in a different style. Okay. Continuing care, regular monitoring. We can say regular supervision, ongoing monitoring. Okay. We can say your regular monitoring. So we can say continuous supervision or ongoing care, comma, um, then ongoing care, then you can say Dr. Rani, very good. One by one writing. Only 3 students have written. So based on the aforementioned circumstances, ongoing care, comma, or continuity of care, okay, ongoing care we have already written here, ongoing. So continuity of care, okay, then um, observation, um, supervision, on continuity of care, regular supervision, regular supervision, okay, regular supervision, yeah, regular supervision and implementing the recommended plan of action would be would be would be profoundly beneficial to improve the current health condition of Miss Ellis. Full stop. This is one paragraph only. In case continuation. In case, comma, any additional information is in case any additional information is deemed extremely prominent, comma, please do not hesitate to contact me. Finished. So this is the introduction and this is the conclusion. Okay. Yeah. So here in between 5.1, 5.5 we have seen. So that is done. Next, what are remaining actually here? So you have to think about these 5 dimensions, 5 components. The first one is, so 5.1, 5.1 is the introduction. Okay. And next, 5.2. 5.2. Yeah. 5.2, you'll write upon admission. Okay. Upon admission. Then you'll write 5.3. 5.3. During hospitalization. During hospitalization, you'll write what happened upon admission. Then next one, 5.4. 5.4. That is upon discharge. Yeah, upon discharge. Upon discharge. Then 5.5 is the conclusion. That's it. Yeah, yeah. So now I want you, whether you have now only the main body is remaining. So introduction is over, conclusion is over. So paragraph. So this introduction is then come from in between upon admission, during authorization, upon discharge. So this is the organization of the letter. So if you have understood till now, so this is the second part. Only 3 paragraphs are remaining now. That we have to go according to the letter to letter. Others are everything same. So um, is the introduction and the conclusion. Okay, clear enough. Yes, or the introduction and conclusion clear enough. So this, whatever I told you, is useful for everything. If you say it is clear enough, then we can go with the body of the letter. Okay. So it is 11:30 and I have to order my dinner and I'll take rest. So if you are comfortable, we can take a class, but I don't know how comfortable you are. Already we have taken a lot of time. So tell me if you are comfortable, then we'll continue. Don't say yes, sir, no. I'll tell you. So if you are say, if you are okay, clear enough is yes, but comfortable or continue, continue is okay. Okay. So continue. When to continue? Today itself. Then you have to type A. Tomorrow. Then you have to type B. never again means you're right. See, some people say, why today, tomorrow, don't want sir. We will do all on our own. There are many students. I say like that. For me, no problem. Anything is okay. Because lot of attention you should have. Lot of attention. Yes. Every sentence I'll tell bit by bit. So today means I need half an hour to 45 minutes because I have to go for lunch. Then we can start. So that is also tomorrow only. Or so I'll take the majority vote. Come on. Today means 12 o'clock. Tomorrow means maybe after 9 o'clock. Yeah. So Mansi, Rajni, Rani once today itself. Okay. And Anita and Anju once tomorrow. What about others? Majority vote. Sakirat and Muhammad Majid. Come on, give your vote also. It's okay. Anytime is okay. No problem. Your wish you can. 3B, 3A. Okay, nobody is going ahead. So it is a tie. So better tomorrow. Better tomorrow. Maybe if I eat afterwards, maybe I'll. That is also there. So better tomorrow. Now give your valuable feedback. So please. So because your comments are very valuable, if you say this type of sessions are very important, then I'll give more sessions like this. Otherwise, I'll reduce the number of sessions. So majority vote, write your comments. Yeah, Muhammad Majid also said B. Yeah, write down your sentences, please. I already explained, and now you can write your sentences. Upon admission, during hospitalization, and upon discharge. So three paragraphs you can write. In the middle, you want to write any personal social history, you can write that also, if it is necessary. Yeah. Last 2 minutes. Those who have joined late, you can take the video from YouTube and you can listen again. want the conclusion part. Yeah. Sorry, supervision, and I made a mistake here. See, and implementing.
Yeah.
So I made a mistake. I also make mistakes. You also can make mistakes. So be careful. Mistakes can happen. You improve like this. Yeah, right. And those students who have joined last week and have to pay the balance fees, you can pay. This week, no, old students. Any pending fees is there, you can pay. Yeah. So you can write this letter and send me. I've already put it in the Telegram channel here. Yeah. See, here it is. Copy post link. Yeah. So that is the link. You can take the case notes and you can write this letter and you can submit. So that is all for now. Good night. Yeah.